I made it into radiology training. I've been applying for 2 years now. I've done a GP training. I've done an IMT as well. So if you didn't get it for the first time, it's really highly competitive. So don't give up. Most of the ST1 radiology training, they didn't come from the IMT immediately. They've done some training and some surface job, then they got it. So why we are doing this presentation? This is for the people who are freshly graduated, and they are not sure which specialty they want. And even though if you are very sure you are not a radiologist, I think this presentation should be enough to convince you to come into radiology as well. Okay, so why radiology? In radiology, it's a really very knowledgeable specialty. You need to learn and to know a lot of things around everything. Maybe just radiologists and GPs, they know everything about anything, not even A&E or internal medicine doctors, because I've seen them in the MDTs, they are discussing with the pediatrician, with obstetrician, with everyone. So if you are really up to medicine and integrated knowledge, radiology is your specialty, to be honest. Again, it's an specialty. What does that mean? During my training in IMT and GP, I needed a lot of services like physiotherapy, radiology itself. I needed so many things. And a lot of my time and effort, I felt I've been wasting a lot just convincing people to come and see patients. So there is some dissatisfaction, to be honest. But in radiology, you don't do that. It's really core specialty. Everyone needs you. You are leading MDTs. So I would say there is no much of non-clinical work for you as a radiologist. Again, the quality of training in the UK of radiology is the best. This is from someone who did a lot of tester weeks in almost every subspecialty before deciding to enter radiology. So it's like individualized teaching. For example, in my deanery now, we have a 1 day full teaching. It's a Wednesday, every 1 day a week for the whole year. And we have an academy placement for month. The NHS is paying my salary just to go and study anatomy and physics. And of course, we've all heard about AI and the rapid development in radiology as well. So radiology in the UK is divided grossly into three subspecialties: diagnostic radiology, nuclear medicine, and interventional radiology, as you know. So it is a 5-year run-through training, which is, again, very big advantage. You don't need to do core training, then get out of training, then reapply again. If you got into ST1, that's it till ST5. Then you finish the training and you get your CCT, which is certificate of completion of training. That's the thing that you need. If you are doing intervention radiology, you will have two or dual CCT, intervention radiology and diagnostic radiology. And it is the case if you are doing nuclear medicine as well. So the type of training scheme in the UK for the radiology, two types: traditional, which is clinical hospital based. You rotate every 4 months in ST1 and ST2, then every 6 months in ST3, 4, and 5. And there is a new, relatively new scheme of training called academy based, which basically you have your own hospital as usual, and you have one block in ST1 and one block in ST2 or whatever, which you go into academy, which is a university funded by the radiology school in your deanery. It is not available everywhere in the country. There are a few examples, like as you can see here, Norwich, Northwest, where I do my training. So it's really improving your chances to pass the exams, because the FRCR exams are very, very tough. There are three: FRCR 1, 2A, and 2B. So statistically, the academy training, they have higher rate in passing the exams. So the training pathway, as we've discussed, of two, let's say, levels. The core training level, which is ST1, 2, and 3, it's a foundation skill. So you will be trained as a general radiologist everywhere in all subspecialties. By the level of ST3, now you will be done with your FRCR1, which is anatomy and physics. And I believe the exam is being held in Malaysia, Pakistan, Egypt, everywhere. So by that level, you will be cleared with the FRCR1. Then you will be sitting for FRCR2A in ST3. So by the level of ST3, you need to choose your subspecialty. If it is, I would say, available subspecialty, you will just get into it without anything. But if you are going into intervention radiology, musculoskeletal radiology, nuclear medicine, you need to do an interview. Okay, because these things are even competitive between the radiologists. So after you choose your subspecialty, now you are in the higher training level, ST4 and 5. In ST4 and 5, you will do 40% general radiology and 60% your subspecialty. Sorry, the other way around. And ST5, then you will do 40-60. However, if you are going into intervention radiology, you will do ST6, one extra year. So the training posts, generally speaking, they are around 350 every year. We are competing amongst them, over them. So the diagnostic radiology, which is CT1 clinical radiology, they are around 300 posts. Recently, in the last 2-3 years, they've invented a new post. So you go into ST1 in interventional radiology directly from ST1. And there are very few around the country, maybe just 25 posts. However, you can do interventional radiology by the level of C3 anyway. So this is the competition ratio. The last one for this year, because they've this is the competition ratio for this year. You can see the cardiothoracic surgery, neurosurgery, they are very competitive because the seats are very limited, 8 seats or 13, something like that. And you can see radiology is very competitive as well. So this is for the last year. You can see cardiothoracic surgery 45-1, then neurosurgery, ophthalmology, radiology. So technically speaking, maybe radiology is the most competitive. Why? Because neurosurgery and cardiothoracic, they are of limited seats, 8, 13. That's why they are very high top in the curve. So let's trace the competition ratio in radiology ST1 training application. So in 2022, the applicant were 2,000 and posts were 360. So the competition ratio was 1 to 6. In 2023 was 1 to 8.7. Last year, sorry, 24 was the competition ratio was almost 1 to 12. And this year, last year, let's say, was 1 to 11. So it came down. Why? The applicant number has increased, but yes, but the posts were much, much more. So in 2024, the posts were 312, and last year was 356. Don't really worry about that competition ratio, it's really high. Why? Because there is something called post-MSRA syndrome. After the MSRA, there is a cut score, which is very high in radiology. It's always 2 to 1. So they choose the highest 700 applicant, they shortlist them into the interview, and now you have 350 posts. So it's actually, if you are passing the exam, it's 2 to 1. So all what you need is to study hard for the SJT and to pass that exam, and the competition ratio will go down from 12 to 1 into 2 to 1. And this is another case to show you as well. So who can apply? Everyone can apply, except if you have more than 18-month experience in radiology, so you are not eligible to apply for ST1. You might apply for ST3 immediately, directly. So you will be counted as overqualified. You cannot apply if you have more than 1.5 year experience in radiology. If you have less than 24-month clinical experience by the start of the training, what does that mean? If you have graduated, for example, 2022, and you, by the start of the post, which is usually in August, you will complete 2 years of experience, that's fine. If you have less than that, you are not eligible. Why? Because the foundation program in the UK, which is we call the internship, is 2 years. So you need to fulfill that 2 years, then you can be eligible for the higher training. However, this year, unfortunately, they've added one extra condition. You have to have the full GMC registration by the time of application. Classically, you didn't need to have the full GMC registration. You can just apply, and by the start of the post, you need to clear your GMC registration. So you have almost 10 months to finish your registration. But this year, they've changed that. So what's our timeline? The application window starts late this month, maybe 23rd of October till 21st of November, roughly. Then, after you submitting your request form, you do your application, you self-score yourself, uh, and you add a letter for every single domain, as we will see. Then you finish your application. You will be waiting for them to invite you to the MSRA. The invitation would be mid December, but the actual exam would be early January. Then the people who are passing the scoring the cut score of MSRA, they will be invited to upload their evidence. So not everyone will be uploading the evidence. That will be in February. However, this year they made it even tighter. They brought the interview very early. Usually the interviews be held on March, but this year they've done that in February. So after you sit for your exam, you need to start immediately to prepare for your interview. It's really tight. And the offers will be in March. Hope all of you will get offer. So what do you need to do? You have to pass the MSRA to score the cut score. 2023, the cut score was 555, which is very high. Last year was 549. Sorry, 544. It came down because the SGT was very tough, and the average of the applicant went down a little bit. So you need to have a good portfolio. This year, the portfolio was weighting 40% of your total score last year. This year, the portfolio weighting 30%. So the MSRA contributing by 0%, just pass or fail. The portfolio weighting 30% of your total score, and we will have a look on the portfolio. So the portfolio itself is out of 25 points. These 25 points contribute to 30% of your total score. That means if you are having 1 point in the portfolio, that equals 1.2% in your total score. So the interview is by 70% this year. So the bulk is the interview. You need to work hard for the interview and for the MSRA. What about the MSRA? The MSRA is an GPA level exam, multi-specialty recruitment assessment. It's like an iPhone clinical or USMLE Step 2, something about the clinical knowledge everywhere. And it's divided into two papers: clinical, which con- constitute of 97 questions. You need to do them in 75 minutes. 11 questions are pilots that are not contributing into your mark, but you would never know which is which. In SJT, you have 50 questions in 97 minutes. I think 95 minutes. So 8 of them are pilots. You have ranking questions and 3 best of 8. If you've never done any ECG questions before, it is a very, very tricky exam. And most of our, let's say, candidates who are IMGs, they do well in the clinical part, but they struggle a little bit in the SJT. Because it's something we haven't been trained for, to be honest. So let's have some sample of that. One sample question. If someone want to volunteer to do that question or to read it for us,
Can read it.
yeah, please.
Yeah, so you're attending a social gathering at your fellow FY1 doctor Susanna's home when you notice a patient task handover on the kitchen table with Susanna's name. The document has specific confidential patient information on it.
So clearly, the question is talking about confidentiality. So we all know about confidentiality. We are a professional, we know that. But the way they are testing you in the exam is different. You need to have not just the concept, the skill to approach that question. So now you have your colleague, she is F1, and she's clearly missing the concept of confidentiality. She's keeping the handover sheet in her house. So what would you do? In A, destroy the handover. B, advise her to discuss that with her supervisor. C, inform her this is a breach of confidentiality. D, to report the incident. And E, to advise her to destroy that. By nature, all of us would say, okay, this is now a breach of confidentiality. I need to eliminate that harm by destroying the handover list, going to A, which is incorrect. That's why it's tricky. In SJT, you have to have some foundation and some appropriate assumptions. What I mean by that, if they are telling you it is an F1, it is there for a reason. So they are trying to tell you she lacks the experience, she lacks the understanding. Your main purpose in this question is to explain to her. Because if you've done A without explanation, she will keep repeating the same mistake. No one will explain that to you. With experience and doing a lot of questions, you will understand that. So the answer would be uh, C, starting with informing her, then uh, E, then B, then A, number four, believe it or not. So I'm just trying to make a point here. It's not a straightforward exam, and it is a ranking, not just choose the best answer. So you might lose a lot of question, a lot of answer, a lot of marks. Sorry, in one question. These questions of 20 marks. Every option is 4 marks. So if you got them all in the right order, you'll get 20 out of 20. And you can imagine now how much you would lose. So the updated portfolio is out of 5 domains. It used to be 7, and the total score is 25. So the first domain is the commitment to specialty. The only domain out of 8 points. The rest of them is just 4 points. That's why it's total 25. Last year was 45. So I think if you don't have that great portfolio, you have a great opportunity this year. Pass the MSRA and do very well in the interview. You'll get a post, and this is really very exciting because usually having less chance to build up your portfolio because you are not in this country or whatever is minimizing your opportunities. But I don't think it's the case. If you are doing well in the interview, this is 70 points and you are passing the MSRA. However, the most important domain is the commitment to specialty because it has 8 points, the only domain. So how can you score 8 out of 8? By doing two test replacement or observation in radiology department, at least for 3 whole days, not even 1 week. So you need 3 days in one hospital and 3 days in a different hospital, and letter stating that you have attended the radiology and the meetings and that. So you'll get 8 out of 25, which is 1/3 of the mark. It's 10%. The second domain is a leadership. So you need to have a post like in a radiology related committee nationally to get 4 out of 4. If you have something non radiology but national level, at the level of the country, like the BMA or whatever, Royal College of something not radiology, you'll get 3. And it's really self explanatory. However, for this post, you need to be in position for 6 months at least. You cannot just have the post or the position for 3-4 weeks and say I will claim the points. They are really strict. So it's worthy to mention that you need to submit you submit your application before November, and you can claim points from the evidence of any evidence before the start of the application window. So if you are doing anything after 23rd of October, unfortunately, they will not count that. So you need to have teaching experience as well. If you are teaching in formal teaching, like if you have a postgraduate level, like master, postgraduate degree, or something like that, will give you 4 out of 4. If you have a major contribution of teaching, like doing online teaching, things like that, they will give you 3 out of 4. So in this year, they merged the two domains of teaching and qualification. So they made it easy for us, to be honest, because we used to lose a lot of marks in these demanding domains. So domain number 4, audits. I think this is very basic. You need to do 2 test replacements, 3 days, 3 days. This is 8 points, and 2 audits. If you are doing 2 audits with the re-audit or second cycle QIP/audit, and you are leading them, and they are radiology related, you will get 4 out of 4. So by doing audits and test replacement or observations, you are scoring 12, which is half of the mark. So I feel this year is really easy for us to get points uh, because the bulk is not in the interview anymore. Sorry, not in the portfolio anymore. Last domain is academic achievement. Again, if you are having PhD, master degree, whatever, or if you don't have that, you can have at least one publication one poster in international conference, so you'll get some point, 3 like out of 4. Let's talk about the interview. This year they brought the interview very early, from 23rd February to 28th February. If you are applying for radiology and GP, for example, by that time that will be the GP. Sorry, if you're applying for GP and radiology, you will sit for the exam in January, because they invented uh, a new way of examining people. We have 2 sets per round now. If you're applying for just GP and psychiatry, you will sit for the exam in February, in this time between 23rd to 28th. But that is not even relevant to ourselves, because we are applying for radiology anyway. So the interview is of 2 stations. It used to be 10 minutes each, now it's 15 minutes each. The interview of 70 mark or point. The pass is 48, you need to score 48, but you need to score 22 minimum in one station. So you cannot score 20 and then 40. No, you need to score at least 22. So station A, you you will be having 4 questions. 2 questions on your portfolio. They will ask you about your portfolio, and you have question about understanding the specialty, like why radiology, what do you understand about the radiology training in the UK, tell us about some experience you had in the radiology. And they will ask you about skill question, like tell us what will make you a good radiologist, tell us what will you do if you face blah blah, something like that. Station B, you'll be asked on clinical scenario and prioritization. It's a very common scenario. They will ask you, if you are a radiology registrar out of hour and you had these 4 scans, which one would you vet or accept? And they will give you clinical scenarios. You don't need to be a radiologist to answer this. You need to be a good um, SHO level doctor to prioritize patients. Uh, how can I choose the best order? That will be subjected to your understanding about the clinical urgency, not just like that. How the modality or the scan would affect the management. Even if it is life threatening and the scan is not going to add anything, that's not priority. So you need to keep that in mind. They will ask you about on coping with pressure and question in team involvement. So they should not be, they must not be radiology related. They might be, but to get a high mark in the interview, you need to understand a very tricky point. They will ask you a question like, for example, tell us about a situation when you've been underperforming or one of your colleagues is doing less, and how have you supported him? You need to give a personalized answer. Don't talk about generic concepts, number one. Number two, to score very high in the interview, you really need to reflect back into radiology and to give an example from your radiology experience. So after giving the answer, uh, telling the event that you have supported your colleague, for example, then you need to go back. And during my test placement, I have noticed that blah blah blah, something like that. So you need to make it very personal and radiology related. Then you will get the full mark in this question. Okay, so let me go back from 17 onward just quickly. Again, these are the domains that will be submitting your evidence against. I can share the presentation altogether.
Yeah, that'd be great. Thank you.
So how to prepare to the interview? Because the interview carries the bulk of your marks, 70%. There are some courses. Some of them are free, some of them are paid. One of the most famous courses here called the Radcast. The other one is UKRST. Uh, Another course called Radiology Interview course. Fourth one, very famous, called the London Radiology course. So they are preparing you for the interview by that level. I would say yes, interview is very important, and you really need to prepare very well for that. Courses are not enough by themselves. So you need to have your individual practice, and one of the best way to do that, if you are working here, to ask your trust or hospital radiology registrar to make a preparation for yourself as a group. That's really, really helpful. And there are some online mocks like Sudanese Uni Doctor Association. They do online free mocks, and you need to, by that level, you need to ask and look for people who are passing the MSRA and sitting for the interview, so you can practice together. You need to do that. So this slide is very important. So in 2023, the total posts were 293. They were very, very less initially. Then they've added some posts. So the total was 312. So the least score got an offer in the first wave, because they release offers in a wave. After 48 hours, they release another wave. Some people, they are skipping the offer. Some people, they are rejecting, because that's why they recycle the offer every 48 hours. So the least score got an offer in 2024 was 69.6%. And that doctor, he ranked 370. So his ranking was 370, and he got an offer. This year, the least score to get an offer was 65%. So it came very, very low, and the rank was 430. So despite the offers, the posts were 350, this 350 posts, the rank of 400 got an offer, because some people, they are rejecting the offer, they are going for other training, something like that. So I'm trying to say, if you are scoring 70% in total, you will definitely get an offer. That's classically. It has never been case when someone scored 70 and got no offer. If you are scoring 69, you will be, I might get it, I might not. But if you are scoring 70, you're on the safe side. So what do I mean by that? For example, this year, if you scored 13 in the portfolio, which is half of the portfolio marks, 13 out of 25, and in the interview you scored 55 out of 70, which is, by the way, difficult score to achieve. Your scaled score would be 13 times 1.8, because as we mentioned, 13 out of 25 points, but this will be scaled into 30%. So times, you will multiply that by 1.2. So plus 55, so your total score would be 70.6. That's why I'm trying to say, at least the bare minimum, you need to score half of the portfolio by scoring 12, 13. Don't do less than that. At least do two placements, two audits. And the interview, you can compensate for that by scoring 55 plus. You will definitely get an offer. It is really tough, but when you know what you want to do, you will be goal directed. So now in the interview, you need to score 55, and in the portfolio, you need to score at least half of it, which is just two test replacements and two audits. Any questions?
I have a quick
Yes.
question.
Okay.
Sorry, go
Yeah.
ahead.
Okay. Thank you very much for the presentation. I have just two questions. So the first one is what I know about especially regarding audits, I know about QIPs. So is it no longer QIP? Is it now two audits or a cycle of QIP?
Yes,
That's
QIB
one.
slash audit. Yeah.
Okay. So then
But
the second,
you need to
okay,
do
okay,
two.
sorry.
You need to do two of
Okay.
them, radiology related, and to be leading the project.
Okay, okay, all right, thank you. Then the
If
second
you-
question is, how long is the evidence valid for? Like if someone does, let's say, tester weeks this year, so how many cycles of application can you use it for? Can you use it for
Very good
next
question, to be
or
honest,
this
because they are
testing?
saying
Yes.
that the evidence is valid for 10 years. So if you have something you have done in the past 10 years, they
Okay.
will count that. But more than that is not valid anymore.
All right. Okay, that's great. Thank you very much, guys.
No worries.
Yeah, so my question was from a few people that have sent it through but couldn't attend. So basically, they think that their main problem with the MSRA is the SJT specifically. Is there a specific course that you would recommend, or like a site that has good questions for SJT?
There are free resources. So I do some online teaching. for SGT, and I do free sessions every month. So you can join the Telegram group, and you can join the website itself. In the website, I have like 12 free sessions. I would really recommend you start by watching them, because they are like mindset changing. As ING, we don't understand. We are good at clinical part, but we don't understand the concept and what do they mean by F1 fellow. Why they are asking uh, here about clinical supervisor, why education supervisor. So I found it difficult in the first place. So I sat for this exam 3 times, to be honest. First time I was not even prepared because I got my IMT training, but the second and third time I studied very well. And despite I studied maybe for 7 months for the second time, I scored just 250 in the SJT. Why I'm saying just 250? Because 250 is the average. So I thought, oh, I studied 7 months for one exam. I will score higher. Then the third attempt, I studied less for the SJT, less in terms of time, but smarter. I started analyzing questions. Why this is this? Why this is this? So by doing so, I scored much higher. Alhamdulillah. So I would recommend you starting with the foundation paper. They are very important. They are essential, to be honest. There are 4 foundation paper. You might ask, where could I find them? In this Telegram group. They've been uploaded for because these resources are open for everyone. So by just scanning the QR code, you'll get into the group. So foundation paper, they are must, and there are few more resources you can expand with after really comprehending the foundation paper, like Oxford, SJT. That's very good resource as well. Online question banks, they are good if you are sitting for the exam written by them, because SJT is not like an evidence-based science. For me, this answer is the best. For you, relatively, the other answer is the best. So if you are working hard, paying a lot of time and money to understand the mentality of the question bank writer, you will be good at this. But when you come to the real exam, it's really a different story. And have lots of my friends and colleagues, they are doing so many online question banks, and it wasn't the case for them in the exam, because everyone is doing the question banks, but not everyone is getting the marks. So you need to work hard on understanding the concepts and analyzing the questions. Why in this question they offered apology, the similar, let's say, situation they didn't offer apology, so there must be a difference. So something like that. You need an analytical way of studying the SJT, starting with foundation paper. And please, if you have some time, just watch the free videos. They are really changing a lot of concepts. You will feel much better and confident in.
Someone was asking earlier, does it have to be 2 weeks, taster weeks for radiology?
If you want to get the full mark in the commitment, which is out of 8 marks, the bulk of the marks, you need to have two. You need to have multiple exposure. Multiple exposure means more than one exposure. So you have to have 3 days test replacement, then 3 days, minimum 3 days. So it might be just 6 days in total, and they will count as a multiple exposure. But you need to make them different by uh, doing them in 2 different hospitals, or one diagnostic and the other one is intervention radiology, something like that. You cannot do two test replacement in the same hospital.
Thank you so much. That was really useful.
No problem. Thank you so much. You're welcome.
Thank you, Kufai.